Researchers from Johns Hopkins University did an extensive study looking at the issues of medical errors and the number of lives that are lost in the United States every year because of these errors. Now, these errors include people who go to the hospital to get treatment for one thing or another, or to have surgery for one thing or another. And then, unfortunately, because they're in the hospital and because of either negligence or other errors, they suffer consequences not even related to why they were in the hospital in the first place. So the medical errors in hospitals and other healthcare facilities are incredibly common and may now be the third leading cause of death in the United States, claiming 251,000 lives every year, more than respiratory disease, accidents, stroke, and Alzheimer's. So the person who led this study is Martin Makary, and his research involves a more comprehensive analysis of 4 large studies, including one by Health and Human Services Department's Office of the Inspector General and the Agency for Healthcare Research and Quality that took place between 2000 and 2008. His calculation of the 251,000 deaths equates to nearly 700 deaths a day, about 9.5% of all deaths annually in the United States. So I give you those details because I think it's important to show you that this wasn't just done by some schmuck. This was done by researchers who looked at 4 studies and came up with this conclusion. And these researchers are from Johns Hopkins University, as I mentioned before. So the results are pretty devastating. And this is one of the stories where, we come across a problem and I'm not quite sure what the solution is. And it seems like the researchers don't have so many solutions either. One of the problems that they bring up is that there isn't like a standardized way of preventing these errors. So you have, let's say, the aviation industry, and there are standardized ways to ensure that people don't die, right? And they're saying that you don't have like a uniform policy for hospitals throughout the country. I don't know how true that is, but that was one of the issues that they brought up.
Yeah, it's really tough. And I don't know how you fix it either. I am confident that there are very few, if any, medical professionals out there who go to work saying, I want the hospital to fail the patient.
Of course.
So I don't think that that's the problem. I think it is hospital to hospital. It's difficult. There are hospitals that are very reputable that are still training people that are still training, medical students on how to perform medical procedures and the like. And so it leads to that. There was one study that came out years ago that really first brought this to the forefront. And since then, they say that the one major stride that's been made is in preventing infections that happen at the hospital. So that is one thing. But the other side of it is, this is also known as a litigious society. If you talk to any doctor out there whatsoever, and I have many friends who are doctors, the malpractice insurance is astronomical.
Right.
And while some studies say that it's come down over the last 10 years, it's still it's tough. So why would you admit when you've done wrong if you've done wrong from a financial point of view? Of course, There's a Hippocratic Oath, but there are these things that we have to at least call out, even if we're not accusing anyone of them, to say that that's part of the dynamic, that we need to find a way that reinforces our priority is health. Our priority is not getting you in trouble. We just need to fix this, even if it may be uncomfortable or embarrassing for a period.
So yes, that was another thing, and I'm glad that you brought that up. One of the other issues that the researchers brought up is if there are mistakes made in other industries, let's say aviation, those mistakes have to be reported. And one of the reasons why they report it isn't just to get people in trouble, it's to prevent those mistakes or those errors from happening in the future. And apparently there is a lack of transparency in the medical field when it comes to these issues. So again, look, I don't think that any of these errors are done because of malicious intent. This is not to blame doctors or nurses or to, demonize them in any way. They have difficult jobs. But at the same time, mistakes happen in every job, and the best thing that you can do is find strategies in preventing it from happening.
Well, on that note of it being the bottom line, having to pay attention to financial repercussions, it is deeply a financial problem on the other end. A lot of these places were found to be understaffed, under-resourced in terms of being able to take care of many patients at one time, but also having someone like a patient advocate or someone to monitor what is going on. In this report, we also had consumer reports saying that after investigating California licensing records, they found many doctors that were practicing were actually on probation for serious violations of patient safety. So no one is paying attention to that either. So I think there needs to be a bolstering of resources, but we also need to pay attention to that.
It's so tough because there's so many layers to what goes into the process of getting treatment. And anybody who has changed doctors knows that it just seems intuitive that my record should be somewhere.
Yes.
But I don't know how to find them, and I don't know how to get them to a new person. I don't know when I got a tetanus shot.
What's really interesting is there are a lot of issues in the medical industry that, we need to deal with. One of them is, there's millennials got surveyed about, the healthcare industry and what they demand, what they want changed about the healthcare industry. And one thing was transparency about the costs of the procedures up front, right? So sometimes you have a procedure done.
Yes.
I know I'm going off on a tangent.
No,
I apologize.
it's true.
You have a procedure done, and then all of a sudden you get a bill in the mail for like $500, and you're like, yo, I just went in for a pap smear. What happened,
Tell me about it.
And so the fact that people are defensive against that demand in the medical industry is hilarious to me. Yeah, you want to know the price of something before you buy it, right? Anyway, that's a completely different issue.
No, that's real. I went in. I went in because I had vertigo, and the person did what sounded like a BS process on me, which involves laying you back, turning your head, and moving forward. And I went to the end, and it's a real it sounds like witchcraft, but it's actually a thing they do because of crystals in your brain. It sounds insane. It was like they did offer me green tea, which I'm like, I don't need your Eastern medicine. I want a pill.
Did you go to a doctor?
No, it's a real. He wasn't a doctor. He was a chiropractor because my doctor was. Anyways, at the end, they're like, your deductible's $3,500, and you don't need to give all of that to us now.
No.
Oh, that's devastating.
I was like, I don't even know what to do. And I just started shouting until I was able to leave without paying anybody anything.
That
and
usually works.
It's a very sad fact.
Yeah.
But that's very real. I don't know what to do. Meanwhile, my friend was on vacation in Mexico, split his head open, got like 4 stitches, and it cost him $10 with an ambulance.
I know. So there are lots of issues with the medical industry. And again, this isn't meant to demonize anyone. I think that people get very touchy about this topic in particular because it paints a negative picture of healthcare providers, of doctors and nurses, and that's not meant to be the point of this story. What we're meant to do here is try to raise awareness about a serious issue because 250,000 lives a year is no joke, and so we do need to find a solution, and there needs to be an open dialogue about it.